Galliprant is a non-steroidal treatment for dogs with osteoarthritis or NSAID, and in this video I am going to explain some of the pros, some of the cons, and everything you need to know about this treatment, because there are things that no one really talks about whenever it comes to treatments for dogs, so it is our duty to bring them into light. Now, if your dog suffers from osteoarthritis or arthritis of the bones, your vet might have prescribed or recommended Galliprant, and Galliprant is one of these new NSAIDs or non-steroidal treatments for dogs. This means that this treatment does not affect the liver or the kidneys within your dog. Whenever we take as humans certain tablets or those treatments tend to be quite bad on your kidneys or on your liver, and the same can be true for your dog, but with these treatments you will not have that problem. Now, how do they work? Well, you have to give one to your dog on a daily basis, and they work by blocking the key receptor involved in the process of inflammation. So far so good. This treatment is prescribed routinely by vets who have patients that come to them and they have a problem with osteoarthritis, their dogs are getting on, and this is one of the options available to them. Now, all that glitters obviously is not gold, and every time you go to the vet, your vet will have to give you certain side effects, or if they don't give you the side effects, you have to be able to read everything you give your dog. And so it is our duty to tell you some of the potential downfalls and some of the potential dangers of Galliprant so that you can be prepared. So certain contraindications is that you should not use this treatment if your dog has a hypersensitivity to the active ingredient or any excipients. You cannot use it in pregnant, lactating or breeding dogs. Now, in clinical trials, Galliprant showed a success rate of 51.3% versus 35.5% for the placebo, with a significant difference. And that if you do not see improvement within 14 days, you should stop using it and consult with your vet. Now, there are certain precautions you have to have with your dog and these treatments. Now, if your dog has a history of sulfonamide hypersensitivity, your dog might show a sensitivity to Galliprant. You still have to be very, very cautious if your dog already has certain underlying issues. If your dog has certain liver issues, cardiovascular, renal dysfunction, or gastrointestinal disease. And gastrointestinal issues are extremely prevalent in dogs these days. So if your dog already has certain underlying problems, think twice about giving Galliprant to your dog. You should always be wary as well of giving your dog concurrent anti-inflammatory drugs or treatments. So do not pair these up, because that can be detrimental as well. And it isn't recommended that you give this treatment to your dog if they aren't at least 9 months old or they do not have the appropriate weight for it. Now, what are some of the adverse reactions? And these are some of the most common. We can expect mild and transient reactions such as vomiting, soft stools, diarrhea, and loss of appetite, and these can be quite common. And there have been some very rare cases of really severe diarrhea post-authorization in the USA. Now, the adverse reaction frequencies range from very common, 1 in 10 animals, to very rare, less than 1 in 10,000 animals. So the risk is not zero. It is never going to be zero anytime you go to your vet and they prescribe a treatment. So it's incumbent upon you to make the decision to balance out the probabilities and the possibilities of certain things happening, and then deciding for yourself without any pressure whatsoever or external input, and for you to decide whether that's the right course of action or not. Now, Galliprant is one of these things that has helped and continues to help lots of people. So if you are watching this and your dog has been on Galliprant for quite some time, it's absolutely wonderful and I am delighted for you. However, we always have to bear in mind that there are those who will not have a good relationship or a good experience with the treatment. So it's important for you anytime you go to the vet, that you do all the research, and that's what this channel is for. This channel is for you to bear in mind all those things that you might not be getting told. Obviously, there are certain cases where I would never give my dog a Galliprant. If my dog were obese, or if my dog had a weak immune system, if my dog, for example, had recurring allergies or recurring gastrointestinal issues, I would not put any more pressure on my dog's immune system in order to fight something else, because the accumulation of treatments cannot be good. It's not good for us, and it cannot be good for our dogs. So if your dog needs to lose a few pounds or a few kilos, I would highly encourage you to look at diet first and to look at how you can slim down your dog. And by the way, if you want a free downloadable with the best diet for your dog, I highly encourage you to download the guide below. So if your dog is already weak, if your dog is already not in tip-top shape, I rather you not do this. You can seek alternative options. You can maybe do certain activities like canine hydrotherapy, and that can be good for joints. You can take the dog on slightly longer walks on softer surfaces, maybe that could be another option, but it is incumbent upon you to look at the whole picture and to determine whether this is good or bad for you. Now, arthritis is no joke, and for example, my dog, as he's getting older, you can see in his back legs that he sometimes struggles. However, in order for you to make the best decision about your dog, I would highly encourage you to educate yourself and to watch as much content around this particular subject so that you can make the best decision for your pet. We have done a few deep dives into osteoarthritis, arthritis, and what you can do for your pet, and you can watch that video next, and that is going to be an absolute winner for you. We have also compiled a few other videos explaining other non-steroidal treatments and how they can help or maybe hinder your dog. And a lot of people who have had certain bad experiences with these drugs, and so it is again incumbent upon you to make the right decision for your pet. Go and watch that video next. I'll see you in the next one.